Good day, everyone. I am Max, the moderator for this webinar. I welcome everyone to today's webinar, Anticipated Changes to HIPAA in 2026. I want to introduce our presenter for today, Mark R. Brengelman. Mark holds bachelor's and master's degree in philosophy from Emory University and a Juris Doctorate from University of Kentucky. I would now like to hand over the floor to the speaker. Over to you, Mark.
Thank you, Max. This is Mark. We are broadcasting live at this moment from the Eastern Time Zone in our capital city of Frankfort, Kentucky. So good afternoon to everyone on Central and Eastern. Good morning to Mountain and Pacific Time. So this is anticipated changes to HIPAA in the year 2026. It's a pleasure to be here with conference panel. Let's move. Here are some content of the program, what this does and does not cover. In the regulatory context of healthcare with regard to the federal HIPAA privacy rights, we try to make some predictions as to what significant changes are coming. There's kind of a twofold source for that, and that is what's already on the radar screen that's coming down the pike, probably started before the current presidential administration, and what, if anything, is the new presidential administration going to interject their own changes, their own information as to what direction HIPAA will go to. We'll discuss why these changes are a matter for daily clinical practice. It doesn't cover all the changes, tries to predict the most interesting and important ones coming. We'll highlight new exceptions under a modernized HIPAA security rule and talk about what may be coming, and I'll give you a take on that. The HIPAA security rule modernization will include legal requirements practitioners need to know. Also, we'll opine a bit on expanded enforcement with the Office of Civil Rights, heightened focus on individual responsibility, as well as practical compliance steps for practitioners to reduce legal risk. So the rapidly evolving regulatory environment for health information privacy and security has been driven by heightened federal security, major rulemaking initiatives, and the intensification of cyber threats targeting the healthcare sector. This has all led to anticipated changes for 2026. So the U.S. Department of Health and Human Services, helmed by Robert F. Kennedy Jr., and the Office of Civil Rights, OCR, have indicated their long-planned security modernization that remains on track with finalization expected in 2026. So there will be notice and comment rulemaking. Enforcement activity is also expanding. Well, together, all these developments reflect a broader regulatory posture. So in the regulatory context, significant changes are coming. With advanced technology, changes to the security rule are meant to keep up with modern times. Let's see, there are key areas of focus with upcoming changes, including patient right to access, security risk analysis, responsibility of data usage with regard to protected health information with emerging technologies, and greater enforcement of fines for failing to take security action. Moving right along now, there are significant changes coming for increased penalties for lack of enforcement, part of the new changes. So the changes matter to you. If you are a healthcare administrator listening to this, if you are a individual who is a practitioner or you manage an office or a clinic, practitioners and patients have to know what changes are being made. So currently, the new security rule is expected to be finalized, but until then, we in daily practice are left waiting in anticipation to see what it's going to look like. So in preparation for the new changes, practitioners and practices should review basically almost all of their documentation. So substance use disorder records fall under HIPAA guidelines, that there's no need to isolate the records. A single consent will suffice. Breaches are now subject to civil penalties, now subject to the breach notification process. We've already gone over the date on the notices of privacy practices, all about breaches, the singular consent form, and all of that will have to be updated internally in training materials to reflect and account for the new changes. So 3 types of resolutions for enforcement actions: imposing civil penalties on persons and entities for failure to comply with the Part 2 regs. Protocol can follow HIPAA guidelines Instead of having the separate requirements, we should lump them into one. Let's move on now. We're in the home stretch, to use a horse term. Cybersecurity expectations and ransomware responses. Be prepared for what to do in cases of cyber attack where there is a patient protected health information or e-protected health information breach has occurred. So with a practical compliance steps for practitioners to reduce legal risk would include updating your internal training materials to reflect all of the new changes. So inform patients of the new procedures, policies, and rights they possess. Keep out for this on the lookout for the new security rule later in the year. So basic tips and techniques to avoid liability. So have we covered it all?
That concludes the session for now. And thanks everyone for participating. You may all disconnect now and have a great day ahead. Thank you, everybody.